Hello, class. This is Dr. Brian Lippincott, and I'm the professor of psychology at the John F. Kennedy School of Psychology at National University, and I'm teaching a class here today about the theories of therapy. And specifically, I'm going to go into the life story of Marsha Linehan, the inventor and the researcher and the fantastic person that she is, who started dialectical behavior therapy in order to help treat people that were suicidal. First, she was interested in parasuicidality, and then she started getting into borderline personality disorder and developed evidence-based treatment. So I'm going to tell you her life story to see where all this came from, and her escape from hell in order to save herself and develop something that could save other people, and her bodhisattva vow. A hero's journey from psychiatric despair to dialectical breakthrough. Out of hell, Marsha Linehan and the birth of dialectical behavior therapy as taught by Dr. Brian Lippincott in the Theories of Therapeutic Process. And here you can see her locked up in the psych ward for 2 years when she was 18 to 20 and really was doing some severe things that would have definitely been categorized now as borderline personality disorder. And some people even might have thought she was psychotic, severely suicidal, dangerous to others and herself mostly. So let's go. The rose, the roots of biosocial theory, the invalidating environment. So she's not talking about biopsychosocial. She thinks that borderline personality disorder comes, I want you to see me for this, that borderline personality disorder comes from the biological predisposition that we all have, or the biological vulnerabilities, depending on what type of word you use, but I like the word predisposition, because it could be things like brain injury, a lot of different things, traumatic brain injury that happened even after your genetics. It can be genetics, but it could be other things, the bio. And then social. There's that social is the invalidating environment that you have. And it could be because you don't fit the stereotypes of the binary gender system, so you're hurt. Or it could be because of being invalidated as a child by your parents. That could be a common one. There's a lot of different reasons why that could be, because you're socially ostracized because of your culture and your ethnicity or what language you speak, things like that. So let's make this go here. Oh, that's going to go away. The rose. Her environment demanded a rose that smells good. And look how it's on style. It's perfect. Her parents pushed for a socially competent, perfect high society daughter. Yes, that's good to repeat that. Dismissing her intense emotional reality with a veneer of positive talk. Everything was surface. You had to be good on the surface. And she was really on the inside a tulip. Marsha was a tulip. When an emotionally vulnerable child is repeatedly met with an environment that dismisses or punishes her feelings, the result is profound emotional dysregulation. Whoa, and let's see some spikes here on the tulip that could be really sharp here. We love you as you are. Do not change. We love you as you are. You do not have to change to be valued. Yeah. You do not have to change. But that's what they're saying on the surface, but is that really true? Let's talk about this. The descent into hell, 1961 to 1963. She gets put into the center, a locked ward that she was in, and she was admitted to the secure, double-locked Thompson 2 unit of this hospital, or this center, which we'll talk about that later. She actually goes back at the end. Marsha drowned in self-loathing. So she hated herself. She hated who she was. She hated her insides and her outside. Traditional psychotherapy was impossible due to her intense anger and mistrust. The medical establishment considered her a hopeless case. So this was 18 to 20 for 2 years. This was back in the 60s when you could be locked up. Okay, yes, for that long. And she was suffered draconian things. She escaped a couple times. She developed friends in there. There's a lot of things that happened in there. But she kept be put back into Thompson 2, which was the unit that was really more highly secured. Turning point in Thompson 2. She's at the piano. There's a piano. God, where are you? She's thinking. If I can find a way to get myself out of hell, I will spend the rest of my life finding a way to get others out of hell too. In the absolute depths of the psychiatric hell, sitting at the unit's piano, Marsha made a solemn vow to God. Now, she didn't realize here that in the Buddhist concept, the Zen Buddhist concept especially, this is called the Bodhisattva vow, that you can't really be enlightened unless all sentient beings are enlightened. So you got to keep coming back forever and ever until all people are enlightened. So Marsha Linehan was a Catholic, and really will go into that, her spiritual enlightenment that she had. But she also was a Buddhist in the sense that she really believed that she was doing this for other people. And it's really true that she really is that way. When you're trained by her, she is just that way as a person. And a lot of it comes, she also always credits Jung, and she also credits her Zen masters that she had and she became. The lifelines and interpersonal anchors that she had. Spiritual guide. Father Anselm Rome validated her deep spirituality and officiated her private lay vows of chastity, poverty, and obedience inside her tiny Albon apartment, Albon Avenue apartment. And she was Catholic and went to church and started being opened up to spiritual guides. She had two of them. One was Father Anselm. But what they did is they said, you can be a lay person. You don't have to be a nun. Because they didn't encourage her to go back into an institution because the institution had been so, that's what Jung would call the great mother, that devouring mother, Kali, the institution, that 2 years where she got eaten up. And if you've ever been in the hospital, you might feel that way too, sometimes, where the hospital is, you can check in, but you don't check out. I've written a little bit about Stephen King Hospital, which is dealing with our contemporary healthcare system if you have to be hospitalized. And they don't have the doctors to treat you. But she took vows of chastity, poverty, and obedience. And she also had a great love, Ed, who brought her profound, ecstatic feeling of deep interpersonal love and connection. That was a romantic love. Okay, the daughter, Geraldine, her adopted daughter. The family she ultimately built, cherished, and lived for. And you can see her and her daughter there, and that's a lovely image of that. Okay, spiritual transforming, discovering the light. Okay, the synthetical breakthrough. Kneeling in the synthetical retreat center, she experienced an unitive golden light. She ran to her room and declared, I love myself, permanently healing her psychological split. So she had a kind of the same as Bill W. had, the same as Jung had, many of these in his red book. She had an enlightened, William James had these. These go back and back. Many, Saint Teresa of Avila had this way back in the 16th century, I think it was. I mean, this is an ultimate thing where you get a psychological breakthrough, a spiritual transformation of an experience that really changes you. The hydrangea moment. Years later, watching a flower move in the breeze, she realized her spiritual search was over. God had never been gone after all. God is everywhere. And so in the mid-70s, she was able to see Marsha Linehan took all those vows. There was no substances involved with any of these moments. She wasn't on psychedelics or anything like that. She saw these things. Yes. Okay. The academic quest for the how. How is she going to save all people from suffering? How is she going to get people out of hell? How is she going to be the Beatrice and Dante and get him and let him lead him through the valley of shadow of death? That's what she's thinking. Graduating from night school to Loyola University in Chicago, Marsha relentlessly pursued her Ph.D. I mean, you got behavioral therapy, you got experiential analysis, you got operant conditioning. Look at the things here, the unconditioned, the conditioned response. She transitioned to behaviorism. She started with Carl Rogerian, just like kind of in this class. Then she transitioned to behaviorism, of learning about what type of things reinforce other type of things. And we'll go into where that has gone. We'll go into self-determination theory, a motivation theory in this class. And a lot of things like acceptance and commitment therapy. But Marsha Linehan was really the rock solid basis of all this. And she transitioned to behaviorism, realizing that individuals could learn new behaviors to alter underlying emotions from the top down. So this is definitely a top-down theory. I'll also show you a video at some point in this class, Albert Ellis and rational emotive behavior therapy and its impact on addictions therapy. But it's the same thing. There's those top-down theories. Bottom-up theories are mindfulness, or mindfulness-based stress reduction, those kind of things. Those are bottom up by changing breath work. All that thing is bottom up. This theory is top down. During her postdoctoral training at Stony Brook, she deliberately took on the hardest, most suicidal cases that other clinicians refused to touch. Yeah, she would. She really did that. Traditional behaviorism, change only. It's a technology of change. It focuses specifically on behavioral and eliminating bad behaviors. The result, highly sensitive patients feel blamed and invalidated. They get angry and quit, which causes a clinical impasse. And right now, that's an argument in post-traumatic stress disorder. I'll just say this quickly, but you have Marsha Linehan's dialectical behavior therapy, which teaches all your coping skills. And then you have Edna Foa's prolonged exposure therapy, which it will cure her PTSD. It's been shown with vets over and over, but half the people or more drop out because it means that you have to go back and experience it. So just the behavioral approach will focus you on behaviorism, but it's change only. It's a technology of change. So if you come from this really, really invalidating environment and you have maybe a borderline personality disorder along with that, that causes an impasse so the people won't continue on, just like the Vietnam vets won't continue on a lot of times. But those that do can be cured. So traditional psychotherapy, acceptance only. That's Carl Rogers. That's why she got away from that. So it focuses purely on compassion and listening. The result, patients feel heard, but are left entirely trapped in their misery. You aren't going to help me out of hell with that. So that created that complete clinical impasse, which you can see the dialectic, thesis, antithesis, back and forth between these and how we need to move beyond that. Integrating Zen, the technology of acceptance. To balance Western behavioral change, Marsha needed a profound, practical technology of acceptance. She found it in Zen, acceptance. Okay, so first she worked with Gerald May, taught her the concept of willingness, open oneself completely to the universe. So if you have a willingness dial and an action dial, if your willingness dial is all turned up where you're really willing to try things, even a little bit of action will get you moving along the path there. So willingness and willingness to experience life and willingness to, which is part of acceptance, the beginning of her learning about acceptance. Then in 1983, she went to Shasta Abbey in the mountains, undertook rigorous monastic training. And I believe she did it twice. The first time she said, I don't think I got it. I want to do the whole thing again. And now I've been on a 100-day silent Zen retreat, 12 hours a day of meditating, walking meditation, work meditation at the Rhode Island, what is the Rhode Island Zen Center? Yes, with Sansanim, the Zen master, which is Korean Zen Buddhism. But I've been through that, and I know how. It's really talking about rigorous, and saying you'll do a 100-day retreat again is really, really hard. Now she did it in 1983. Zen master in 2012 authorized her as Zen master by Wilgus Jager and Pat Hawk, precisely because she had achieved the selflessness of not caring if she became one. She said, "Oh, I don't care if I get this enlightenment or not." You're enlightened because you already are enlightened, but that's the thing that a lot of us don't realize. Okay. Dialectics of synthesis. So this is the main dialectic here that we have as therapists. We're trying to change people. People are coming and paying to us because they want to change, and we want to change them. That's why we become therapists. On the other hand, we have to fully be accepting them. Carl Rogers have to be there totally with you, listening to you and accepting you just as you are. But if I'm accepting you just as you are, how do I want you to change? So you have to make sometimes dialectical interpretations. Which a dialectical interpretation is 5 things. Wow, I can see why this is really hard for you. I can see how this is really difficult. I can see how, well, when your friend group did that to you, it really made you feel like they didn't care about you as a person. They were treating you like a tool. You have to accept and validate. That must have been really hard. Wow, but you survived it and you got through it and you went to work the next day and you didn't use drugs. Oh, wow. So you're accepting, but you're not. For 5 times, Marsha Linehan says, for somebody that meets criteria for borderline personality disorder or is extremely suicidal, before moving for a little bit change. So, wow, I can understand how that was really painful for you, and you really felt like you were losing contact with reality. And we have to find a way for you to experience that pain, accept it, and be able to stay with reality. Okay, that's putting it in one sentence, but it doesn't go that way. You have the validation has to come significantly more. The breakthrough clinical stance. The therapist radically accepts the patient exactly as they are in this moment, while simultaneously fiercely acknowledging that they must change their behaviors to build a life worth living. I have a colleague that works with women who want to lose weight is one of the things, and they have, like a lot of people do, eating, emotional eating, and a lot of different things. So what she does is she brings snacks. One snack is like really, really healthy, like maybe some celery, some vegetables, maybe a little bit of peanut butter on some of the celery, okay, something like that. And then she brings like cake. And she talks about which one. You can have either one. It has to do with him, but which one, you're in a dialectic between these two things. So it also ties in a little bit with internal family system. I don't think Marsha Linehan would go along with that, but it does because of the different parts of the self. But this acceptance is something, and change, I'm talking about the whole field of psychology. We have to balance these two sides. Radical acceptance, I'm going to talk about when we deal with this with things that aren't acting out, externalizing disorders like antisocial or borderline, that kind of thing, cluster B type of things, but how to deal with some of the other things that are more internalizing, the people on the spectrum. This is a great theory for that, but we'll have to go more deeply into it, and along with ACT. The therapist radically accepts the patient exactly as they are in the moment, while simultaneously fiercely acknowledging that they must change their behaviors to build a life worth living. So that's a difficult job to hold both those. Now, the 4 modules of DBT, because in order to get the full Monty, the actual whole DBT, you have group like for 2 hours a week where you're talking about these 4 things here, and you're learning an actual skill-based group, like how to do this, and you're not really processing your information. You have a lot of therapy, for individual therapy, where you're actually going deep and you're processing, and your therapist is like a cheerleader, and they're really connecting with you and validating you. And you have the ability to call people and get help. They have diary cards. A lot of places that implement DBT have social workers to do other things like job coaching, other things like that. You have support system, but you have to have it. And then all the Therapists have to be in a DBT supervision group, no matter how long you've been doing it, because clients will reinforce the behavior of the therapist not doing good therapy, but they'll reinforce, they'll really love you up when you're doing things that aren't going to be helpful in actually solving the problem. Okay, there we go. Now, mindfulness, that's the core, the Zen foundation, just observing your breath going in and out of your nose. Describing. Well, I started worrying about my checkbook. Oh, then you come back to observing, and then you describe if you have a thought. Oh, I was worried about money. Oh, I'm worried about love. Oh, I'm thinking about sex. Or whatever it is. Then you just pull yourself back gently, participating in the present moment without judgment. That's a key thing that you're going to go to in the skills training, is how to not judge. And most people, how to shut off this inner critic and get into flow with that part that isn't judging you all the time. I'm doing it because this is the part of the brain it comes from, that frontal lobe there. Survive, distress tolerance, how to get through a crisis without making it worse. Every time you watch TV, you're going to see a cop. His daughter won't talk to him. His partner won't talk to him. His boss, he's afraid of losing his job. He's assigned this super difficult case. People could get killed. And where does he go? I'm all stressed out. He goes to a bar. Now, somehow they work that into the story, but that's not real life. That's actually going to make it worse, right? I'm just giving you an example of that. This is literally about how to survive crisis without making them worse. Radically accepting reality exactly as it is. Radical acceptance. We're going to talk about that as we go more deeply into this. Not today. This is just telling you the life story of Marsha Linehan. She had to learn how to regulate her own emotions, understanding the function of emotions and reducing biological vulnerability to extreme emotional swings. You have some people that meet criteria for borderline personality disorder. They have a high shot. They really get aroused quickly. They can go 0 to 90 in like a second, really blow. But then they have a slow return to baseline. Like I know people that don't meet criteria for borderline disorder, but they have maybe anxieties or things. They really can get caught off guard and shoot up, but they go back to baseline really, really quick. People that meet criteria, they really can shoot up quickly, but it's slow. It could be days or months before they return back to baseline. So they stay in this overly dysregulated state. So we have to teach them how to regulate their emotions, understanding the function of emotions, and even be able to label them. And I will tell you that in child therapy, the biggest noticeable change for children from 5 to 9 in going through psychotherapy is that they can describe their emotions. It's kind of, therapy is a kind of prevention for alexithymia. Alexithymia is not being able to describe your emotions or even realize you're having emotions, which a lot of people with severe PTSD have. And people that are in this category too, or sometimes people on the spectrum, which we'll talk about later, how to deal with all these things. Understanding the function of emotions and reducing biological vulnerability could be from CET, from playing in the NFL or a lot of football and getting brain injuries, to extreme emotional swings and interpersonal effectiveness. Navigating relationships, asking for needs. People have a really hard time asking for help and really hard time accepting it. Some people are really, really goody, and some people are against people and are afraid. Some people are trying to get pleasure. Some people are trying to avoid pain. So you have to teach different interpersonal effectiveness training according to the type of person you're dealing with, the type of client, how to navigate relationships, asking for needs, because it's really interesting. Asking for needs, asking a waiter at a restaurant that you ordered the steak well done from, and it comes raw to you, how to deal with that person. The first thing you're thinking is, I really want to get my steak. That's more important than my relationship with the person. But if you're dealing with grandma, who's 90 years old, who always loved you, but still gives you $1 on birthday, but the fact she always remembers your birthday, that's grandma. You might say, oh, the relationship is more important than confronting her on her politics, right? Oh, because that's teaching about asking for your needs and understanding other people's needs. It's like theory of mind. She's really trying to improve that in interpersonal effectiveness training. And while saying no, while maintaining self-respect. Yes, it's a lot. Finding the synthesis within. Emotion mind, you have on one side. That's the fire, driven by feelings, urges, and intense moods. Logic is offline. We have to, emotional line, we have to learn urge surfing, which is one of the techniques in DBT. Reasonable mind is over here. It's like a machine, driven strictly by logic, empirical facts, and going into planning. Emotion is offline. But here, the sweet spot, just like the flow state, is right here in the middle. That's wise mind, the deep intuitive synthesis of both emotion and logic. Emotion can respond quickly in an emergency. It's what Kahneman called the fast response, fast thinking. Logic is slow, but it made me better decisions for you in certain situations. So you want to have a synthesis of those things together. The calm, knowing that guides skillful action. Being able to act, but be skillful about it. In your interpersonal effectiveness, your ability to deal with distress. I have a little short about the basketball player, the woman basketball player that they keep knocking down, but she has emotional regulation skills. I'll think of it at some point. I might connect it down below into this show here. I might connect the short of that basketball player below. So here we go. Moving along, so we have wise mind in this sweet spot between emotion mind and reasonable mind. That's something you really want to remember. Now, these are just a couple of examples of her skills. We have the tip skills, which I use all the time, personally on myself. I go swimming every day, but what the tip is based on the mammalian diving response, which is a physiological response. Every mammal, when they dive underwater, you calm down. It brings you down and you could control your breathing and it changes things. So that's why ice works. Now, sometimes if you have cutters, people that cut here, and they report that they like seeing the blood, what I have found to do is get the ice cubes and put this really red dye in it. And then when they put the ice on their thing as a substitute, they see that red. It gives them, now some people might say that's contributing to it, but that's a coping skill. That's one of the coping skills. But the stress tolerance skill, as an example, changing body chemistry to rapidly reduce extreme emotional emotions. Temperature, cold water to trigger the mammalian dive reflex. So you can even just stick your face in cold water. Just if you have a sink, you stick your face in, that's the T, that's temperature. Intense exercise. Then sometimes you run out the front door and you run until you can't run anymore, and then you try to run back. And then you might wind up walking, and then paced breathing, paired with muscle relaxation, like yoga nidra. You can make tapes for your clients, but they just come back and the box breathing. 5 in. Hold it for 5. 4, 5. Breathe out for 5. Hold it out for 5. 4, 5. That's box breathing, like a box. But that will regulate that will pair your relaxation with paced breathing. If you're just relaxing and you're doing a body scan, all those things are things that you can use, which you're probably already using those if you're in practicum yet, because you're going to learn these skills. But Marsha Linehan in Dialectical Behavior Therapy has these into a cohesive therapy. And also what I'm talking about today is how she developed these things. If you read their book, A Life Worth Living, Making a Life Worth Living, by Marsha Linehan, her memoir, which I encourage everybody to read. You'll learn all this, even more than this, but I'm giving you a little taste. These are core skills in action. Opposite action, emotional regulation skill. Now, why is it that people, when they're sad, most of the time they listen to very sad music? And I have a video on music therapy that talks about this. Why do we always listen to very sad music if we're sad? No, we want to have the opposite action. So we want to listen to really funny music or really upbeat music. or whatever we think of as upbeat. And you could talk about playlists with the client when they're feeling down. Okay, if you're feeling anxious, you want to listen maybe to other things or movies. You don't want to watch. You probably might not know this reference, but Tears of Endearment is about what famous actresses. They're really good acting when the mother dies, and it's like a lot of loss. Or like if you're a kid, Bambi. That's why you don't want to watch that if you're feeling down. You want to watch the Three Stooges or something to get you in the opposite direction. When an emotion does not fit the facts of the situation, acting exactly opposite to the emotional urge to eventually change the emotion itself. And she has a technique called the half smile. And feel it. Just put a little smile on your face, just a little one. That comes back from William James, that the smile actually comes first. And you'll notice, I feel a little bit happier when I smile. That's the half smile that you can walk around with that. Nobody really notices. Retreat, fear, give up. No, you got to keep going. That's the opposite of that. But I'm just giving you examples of emotional regulation skills. And the first emotional regulation skill is naming the emotion. Is this rage? Is this threat? I feel threatened. Is this, I'm suffering. I'm depressed. I'm deeply depressed. I'm sad. You can give colors to things with young people or with anybody really, whatever. And it doesn't judge the color. Sometimes black is good, white is light, or yellow is great, spiritual. Some people it's not. Some people think green is envy, but it's not always. But once you figure out what colors represent what emotions, especially with kids, it'll be consistent then. You got to calibrate it. That's a whole other expressive art lecture to give. In June 2011, Marsha returned to the Institute of Living. That's the name of the place, the Institute of Living, which she was locked up and felt like she was in hell. But she goes back and she looks at her own record, and she's Marsha Linehan at this point. And she says to the audience the message. She said a whole lecture, but which has been recorded. If you can do it, if I can do it, you can do it. If I can do it, you can do it. She explains where she was at. What a role model. Exactly 50 years after she was locked in seclusion, Marsha Linehan returned to the Institute of Living, IOL, in Hartford. For the first time, she revealed her own journey through psychiatric hell to her colleagues and patients, whoever came. And it was filled. This was free talk at the Institute of Living. Okay, thank you very much. Let's go. Building a life worth living. Marsha Linehan transformed her deepest personal agony into the most effective psychological treatment for highly suicidal individuals in the modern era. So she was able to help people get out of the darkness by integrating rigorous behavioral science with radical Zen acceptance. She kept her promise to God. And also, I would say she always attributes a lot to Jung. So there's a lot of the transcendent function that Jung talks about. She allowed people to rise above, and she got enlightenment. She found, her story is a lot like the Buddha in a sense. She found a way out of hell and left a map for millions of others. Yes, Marsha Linehan. Thank you very much. Well, I appreciate you listening to this lecture and hearing the story of Marsha Linehan. It's very important to me. Monterey County paid $30,000 for her and all the people to come down and train us, and it was a fantastic event. And meeting her was exciting. And I didn't even know her story at the time of what I was really getting into. I just knew this was an evidence-based treatment, and I was being said, you need to learn this. And community mental health, the average therapist has 40 to 50 clients. In the DBT team, you only have 8 clients, and you have to be in a special group and your client can get a lot of phone calls and we have specialists working, create diary cards, and the client learns how to actually do the skills. So, thank you very much. And if you have questions, you can ask me in class, or you can leave comments down below and I'll be happy to answer them.